Thank you guys for coming to our Day of Beauty. And guess what? We're at it again. We're going to do some fillers and transform a face and a life with fillers. So Gina's here. And how long has it been since you had filler?
2 years.
2 years. Okay. So you took a little hiatus. Now tell me how you feel after you do the fillers.
Oh my goodness. Refreshed, younger, happy, full of life, and really wanting to show my face to everyone.
So it gives, that's the nice thing about fillers. People are talking about how we need to get rid of fillers, and people are overfilled, and people are saying you should never get fillers. And it's absolute hooey, for lack of a better word. It's total hooey, because really that's what's made people look natural and youthful in today's society. We can get a facelift, but it actually will look cold unless you soften it with lasers and with fillers. So fillers are really a magical thing. And we're going to just show how with just a little bit of filler, we can make a person look fresher. And also the thing that I think is more important is give you that self-confidence back. And so let's just show what we're going to do. We discussed it with Gina before we got the fillers ready. She has a little bit of hollowness here in her temple, so we're going to soften that. On the brow, she's got a little bit of fullness here, but I want to give it just a little bit more. On the jawline, we're going to lift this up a little bit. We're going to soften these marionette lines here. She doesn't want any lip. I always like a little bit of lip, but she doesn't want any lip, so we're not going to force her. We're not going to hold her down and make her do it. And then we're also going to put a little bit in here. Sometimes I also like to put a little bit on the nose, if you don't mind. It just softens a rhinoplasty, because you had a rhinoplasty, correct? Mm-hmm. And so you can see with a rhinoplasty, it just gets to be a little bit peaked right here. And then it's got a little bit of, it looks a little bit artificial. So if that's okay, we'll soften that a little bit. Yeah. Okay, great. So let's get started. I'd like to start with the top down. And so we'll do the filler in the temple area, which I think is really a big, big game changer for people. And so we just take Loma. This is Loma. And now I'm going to use a lot of different kinds of filler. Loma is one of my favorites because it lasts for 2 years. And I love something that's going to last for longer is better. But what's also great about the hyaluronic acid fillers, which is Loma, is that you can melt it if you hated it. And I've been doing this long enough. I almost never melt fillers in my patients because they like it so much. Why would you melt it? Okay, and you can see if you look there on this side, see how much softer that looks than this side over here. See the hollowness right there. So just right away, we'll make it look softer and fresher. Now, and how's the pain, Gina? Is it okay?
Yeah, so far so good.
Okay, now I just like to make sure that we're not on a blood vessel. And we were just talking about occlusions because people worry about getting a filler into a blood vessel, which could cause a little bit of sloughing. But I've done this for so many years, and I've had a couple of occlusions, and I've never had scarring or anything bad happen from a hyaluronic acid filler because you can melt it if that were to happen. So it's unlikely to happen, but when people talk about that, it's really nothing that I've seen any long-term consequences from using the hyaluronic acid fillers.
When you do see fillers that, I don't know if you consider them bad fillers, but is that always hyaluronic acid?
Usually, if you see really bad filler, it's going to be silicone. And almost 100% of the time, we're in California, we live close to the border, and so we have a lot of people who go across the border to save a little bit of money. I don't really understand this because I think by the price of gas now, it's going to cost you, I don't know, $50 to $100 just to get to Mexico to do it. And I'm not trying to bag on Mexico, but that's where I see, being in Southern California, that's where we see the really bad filler with silicone. The other thing that happens is if you go to somebody who really doesn't have a lot of experience and they don't understand the whole face and the different proportions that you're supposed to have, you can get some really bad looking stuff because they'll just focus in on the lips and they get bigger and bigger and bigger and more distorted. Same thing happens with cheek, nasolabial fold, any area where you get obsessed with it, it starts to look really unbalanced. And that's when people are saying you need to get rid of the fillers. Okay, let's do this. So now we're going to do a little bit into the brow just to soften this up. And you can see I'm going up into the forehead because she has a little bit of a trough just above the eyebrows too. And this is a very vascular area, so I would not be shocked if we got a little bit of a bruise. And that's one of the main things that can happen with fillers. I've been doing it for a long time, but I still get bruising in some people. Now, people like cannulas because there's less risk of bruising in theory. I'm not a fan of cannulas at all because you can't place the filler where I want to put it. So you can see it's just softer. And we'll put a little bit into the brow itself. There we go. There, that looks so nice. Then I just want to get this little area here where there's blood vessels. I'm going to be really careful. Yep, and I did hit a vessel right there. So we're going to just have to put a little pressure. Thank you, Lee, for that pressure. And again, a bruise is normal. Unfortunately, it happens. Okay, so now we're going to do some in between the eyes because I'm going top down. And so we're going to use Define. This is a little bit firmer. It sticks together a little bit more because I want to use it in this crease, so I don't want it to move out and about and around. So we're just putting a tiny little bit. How are you feeling, Gina? You doing okay?
Yes, thank you.
Okay, good. So just a little bit to fill in these tiny little forehead creases. These are the 11s. These really bother people. Usually we'll do a little bit of Botox along with the filler in these areas here. Okay. Now I'm going to do that little dent in her nose right here. You okay?
A little pinchy.
A little pinchy. I call it the Hollywood effect because it really changes your nose and makes it just look softer. And there we go. And a lot of times people like their nose more than anything else we do, which I think is fun. Okay, so now we're going to try to soften these marionette lines here is what we call them. Doing great. You're doing so well. It's a little pinchy for sure. But I try to get into a rhythm so it doesn't hurt as much. I think when you can sort of anticipate where I'm going, it makes it a little bit easier. And there we go.
Can you explain, is this taking the place of having to do a mini facelift?
Mini facelifts will help with the jawline. They'll help with the neck here. So it's going to lift it up like this. But when you do that, you can still see that where you've lost some of the volume, it's going to make it look fresher and more natural. And because with facelifts, oftentimes it'll create dents in the skin. So you actually, after a facelift, oftentimes will put a little bit of filler to just smooth things out and make it look more natural. Okay, how are you doing, Gina?
Good, thank you.
Good, good. It's looking good. Okay, there we go. Love it. That bruise right there. And bruise on the other side, which is great. There we go. That all looks good. Okay, now we're going to do just a little bit of jawline filler. Oh, actually, why don't we just plump up the cheek just a little bit. Just a little bit. I don't want to make her too cheeky, but I do want to have just a little bit of fullness. And I use the word soften a lot because we just really like to soften the transitions in the face. And
I love the cheeky look.
you like that?
Yeah.
I don't want it to be too much. And a lot of people, smile for me, please. See, we don't want to make her too round in the cheek because then it'll look artificial and you lose the proportions when you overfill one area. It can look too exaggerated. Okay, we did a little bit in the cheek and now we're going to just do a little bit in the jawline. And have you had a facelift, Gina?
Yes, a long time ago.
It looks good. They pulled you nice and tight, I think, so it doesn't look like you need one at all.
The wind blown. It was about 15 years ago.
Wow. Who did it for you?
Dr. Fisher in LA.
And see how nice that looks. That just smooths everything out. And for women past 50, doing the jawline is so important because this part will disappear for women. In fact, they lose the bony structure here a lot of times. And then this will disappear as well. And so you get this sort of no longer straight, smooth jawline. There we go. And then we have one more here. And today we've done 2, 4, 6, 7 syringes. And people get worried that they're going to be overfilled, but you can see from doing 7 syringes, Gina still looks very natural and fresh. She doesn't look overfilled or overdone at all. And for people that are getting fillers done, I recommend that you come in every 6 months because most fillers last for anywhere from 1 year to 2 years. And so at 6 months, some of it's gone down. And so we just can just go to the areas where we need to freshen it up, but not continue to overfill and overfill and overfill. There we go. Let's just see from the front here.
You also have a great eye, doctor.
Oh, thank you.
Symmetry.
Yes.
I never feel unbalanced when you do the fillers, which is great.
Thank you. Thank you.
That's so important to have the right doctor who has a good eye.
That really does help. And the longer you do it, the better you get at it. And for people that are newly doing fillers, it's really important to look at beautiful people and to figure out what makes them look beautiful. And that helps you when you're filling faces. The other thing is to look at people when they're older and younger and see what the difference is, because that way you can see where you need to fill. For example, things that happen are this moves forward, and there are just different things as aging. It's a whole topic unto itself. So you can see Gina, you can see we filled in here. It looks really nice and soft. We put a little bit in the brow, which is really nice. We gave a tiny little bruise, which I like to have happen actually, because this is something that can happen with facial fillers. It's actually common and to be expected. We softened the nose, which I think came out really nicely. I would have liked to have done a little bit more, but Gina said no. She didn't say no, thank you. She said no, so we didn't do that. And we did the cheeks, which is really beautiful. We softened the marionette lines and then straightened out the jawline here. So I'm going to show you, Gina, what we did, and so you can take a look at the reveal.
Oh, it's gorgeous.
Isn't this nice?
All around my mouth, everywhere. It looks beautiful. Thank you.
Yeah, you look so good.
Wow. And it looks natural.
Mm-hmm. Yep. So
Really. I don't think on it. It looks great.
And that's the whole goal with this, is to make you look fresher, but not have anybody go, "What did you do?" Mm-hmm. So that's what we always want. So I hope people tell you how beautiful you are.
Thank you.
More than they already do, I'm sure. So, okay, thank you guys for tuning into our Day of Beauty. We really appreciate it. It's a great opportunity for people to look beautiful and save some money at the same time. So thank you for your support.